let's start with the Cefaly.
Sure. So the Cefaly device is what we call an external trigeminal nerve stimulation device. It came out in 2014 first for the prevention of migraine, and then later found to be useful as well for the acute treatment, and that was in 2017. Doesn't need a prescription. You essentially pay a one-time fee to get it, and then you also get electrodes, and the electrodes are this sticky pad, if you will, and it attaches right here. So it's targeting branches of the trigeminal nerve, like your supraorbital nerve, your supratrochlear nerve, and it will then this device, the first version of the device, it's a circlet design. I call it something out of Star Trek. It originally looked like a visor that went around your head. Then it went through a remodel. Now it's a much more simplified, if you will, device that sticks right here. When you use the device, it is, thank you, Kelly. It again sticks to the electrode, so it's on your head like that. When you turn it on, the beeps you hear correlate to what kind of treatment you're getting. So one beep indicates acute, which you'll be using it for 60 minutes, and two beeps is preventative, which you'll be doing every day for 20 minutes. When the device is running, it will have varying intensities. When you press it, let's say it's too intense, you can press it to adjust that intensity. And again, the way this device works is that, again, it's modulating the trigeminal nerve, one of those we were just talking about. That's the nerve it's modulating. So one of the common side effects people might encounter is it could cause drowsiness. But when it comes to these devices we're going to be talking about, side effects are generally lower than what one would experience when taking a prescribed medication like an oral medication or whatnot. I get commonly asked, can I do this with Botox? I tell patients, don't put it on after getting your Botox therapy, but after that day, of course, there's no contraindication using Cefaly with Botox. I do say people who have had a recent head injury or history of seizure, talk to your provider first. And with most of these devices, if you have an implanted metallic device or electronic device in your head, that is a contraindication of not to use it.
Again, this is the Cefaly device. This is the electrode that goes on it. They're sticky. And then it goes right here. And this is what it looks like. And there we go.
So one last thing of the Cefaly is a lot of devices, and they have other uses as well. There was a recent study that showed some evidence that it could be useful for those with vestibular migraine. And I look forward to future studies they do with